a knee that stays sore longer, a meal that leaves you heavier, and a poor night of sleep that seems to steal the next day may look like three separate problems. Then exercise stops producing the same response. The waist expands more easily, and small infections take more out of you than they once did. Most explanations isolate each change. The joint is blamed on cartilage, the fatigue on age, the waste on calories, and the slower recovery on bad luck. But the body does not age as a collection of sealed rooms. Blood vessels, muscles, fat, brain, gut, and immune cells are constantly exchanging chemical messages. That communication explains why several systems can lose resilience at the same time, even when no single organ appears dramatically sick. The first clue is recovery. A young system can react strongly to a challenge and then return close to baseline. An older system may settle a little higher each time. Think of a smoke alarm that works perfectly during a fire, but keeps chirping after the smoke is gone. The alarm is useful. The failure to become quiet is the problem. Your immune system uses a similar alarm. Injury or infection triggers heat, swelling, immune traffic, and repair signals that protect damaged tissue. That short response is not the enemy. Without it, wounds would not close, infections would spread, and exercise could not trigger normal adaptation. The danger begins when the signal never fully returns to quiet, even though there is no obvious fever, wound, or infection demanding attention. At that level, you may feel nothing specific. The signal is too small for a dramatic crisis, but persistent enough to influence how cells use fuel, repair proteins, and respond to hormones. This is the hidden process, chronic low-grade inflammation associated with aging, often called inflammaging. It is not all of aging, but it can accelerate many of aging's visible consequences. I would describe it as a biological tax. Each signal is small, yet tissues keep spending energy on defense, instead of using all of it for maintenance, movement, and renewal. Over months and years, that tax can narrow your reserve. The same walk costs more, the same meal is handled less efficiently, and the same strain takes longer to repair. This does not mean every ache or tired morning proves inflammation. It means the same background signal can help explain why several ordinary changes sometimes travel together. Once you see the shared signal, the useful question changes from which organ is failing to what keeps the alarm active and what helps it switch off. If you value explanations that connect the whole body, subscribe to Feynman's body code and tell me your age and country in the comments. I'm especially curious which change you noticed first. Slower recovery, less energy, weaker muscles, a growing waist, or more stiffness in the morning. Now we need one distinction that prevents almost every misunderstanding in this subject. Inflammation has an activation phase and a resolution phase. Activation brings immune cells and chemical messengers to a problem. Resolution removes debris, calms the messengers, and allows rebuilding to take over. These are not merely opposite switches. Resolution is an active biological program, and a response can begin normally yet end badly if that program is incomplete. A useful analogy is a repair crew that closes one lane after an accident. The closure is protective for an hour. Leaving the cones there for months damages the whole road. In the body, persistent signaling can keep vessel walls reactive, make insulin signals less effective, and tilt muscle toward breakdown rather than rebuilding. Researchers have even tested this pathway directly in people with prior heart attacks. Blocking one inflammatory signal reduced recurrent cardiovascular events, but also increased infection risk. That result matters for two reasons. Inflammation can influence disease rather than merely accompany it, and simply suppressing immunity is not a safe-home anti-aging strategy. The goal is not zero inflammation. The goal is a system that responds when needed, resolves the response, and returns resources to repair. Why does that return become harder with age? There is no single source. Several small sources can feed the same circulating signal at once. The first source is a change in damaged cells. Some cells experience stress or DNA damage and enter a state called cellular senescence. A senescent cell usually stops dividing. That can be protective because a severely damaged cell should not keep copying itself. The problem is that some senescent cells remain in tissue and release a mixture of inflammatory signals, growth factors, and enzymes known as the SASP. Picture one difficult neighbor broadcasting an emergency message to the entire street. Nearby cells change their behavior even though they were not originally damaged. A small number of these cells may help wound healing for a short time. Accumulation and prolonged signaling are what make the same program harmful. In animal studies, clearing certain senescent cells can improve selected age-related problems, which is scientifically important, but not permission to buy a so-called senolytic supplement. Human aging is more complex. Senescent cells are not all identical, and products marketed online have not been proven to safely clear them throughout the body. The practical lesson is not to hunt one magical compound, it is to reduce the repeated damage signals that create and sustain the inflammatory environment. The second source sits around the organs rather than under the skin. Visceral fat is metabolically active tissue, not an inert storage bag. As fat cells enlarge, blood supply can become inadequate, stressed cells release distress signals, and immune cells enter the tissue to manage the damage. The tissue can then produce more inflammatory messengers, while those messengers make insulin signaling less effective in muscle and liver. The pancreas compensates by releasing more insulin. For a while, glucose may still look acceptable, but the system is working harder to produce the same result. This creates a loop. Insulin resistance favors more fat storage, more visceral fat adds more signaling, and the loop becomes easier to maintain. That is why waist change can matter even when body weight changes little. Two people with the same weight can carry very different amounts of metabolically active fat. It also explains why aggressive dieting can backfire after 60. Losing muscle along with weight reduces the tissue that clears glucose and protects physical reserve. The better target is usually improved body composition, less excess visceral fat when present, while preserving or building muscle. The third source is the boundary between you and the outside world, especially the gut, mouth, lungs, and skin. These surfaces constantly negotiate with microbes and particles. A healthy barrier allows nutrients and useful signals through while limiting the movement of microbes and irritating fragments into tissue. With disease, poor diet, smoking, some medications, and age-related changes, parts of that barrier and its microbial ecosystem can become less stable. The phrase leaky gut is often used too casually. The accurate point is that intestinal permeability and microbiome changes can contribute in some people, but they are not a universal diagnosis. Oral health is easier to see and often ignored. Inflamed gums create a persistent local immune burden, and treating periodontitis can reduce systemic inflammatory markers. Bleeding gums, loose teeth, persistent bad breath, or painful chewing are therefore not cosmetic details. They deserve dental assessment. The fourth source is inside the cell's power system. Mitochondria turn fuel into usable energy, but damaged mitochondria can also release molecules that resemble danger signals. Fragments of mitochondrial DNA outside their normal compartment can activate immune sensors, as if the cell has detected material from an invader. Normally, damaged components are removed through cellular cleanup systems. When cleanup falls behind, biological debris accumulates and keeps signaling trouble. This connects inflammation to several other hallmarks of aging: mitochondrial dysfunction, impaired cleanup, cellular senescence, altered nutrient sensing, and damaged communication reinforce one another. No single arrow tells the whole story. The important feature is feedback. Damage creates signaling, signaling disrupts repair, and weaker repair permits more damage. This is why a silent process can affect everything without being the sole cause of everything. It amplifies weaknesses already present in different tissues. Daily behavior can turn the volume of that amplifier up or down, although it cannot erase genetics, disease, or every effect of age. Sleep is one of the fastest examples. Controlled sleep restriction studies have found increases in inflammatory signaling, along with greater pain and fatigue. One bad night is not permanent damage. The concern is a repeated pattern that denies the immune and metabolic systems a reliable recovery window. Obstructive sleep apnea deserves special attention because repeated oxygen drops and arousals can add cardiovascular and inflammatory stress, while the person may only notice snoring or daytime sleepiness. Physical inactivity creates a different problem. Muscle is not only machinery for movement. Contracting muscle releases signals that communicate with fat, liver, vessels, and immune cells. A bout of exercise can temporarily raise certain inflammatory molecules. That acute pulse is part of adaptation and should not be confused with chronic background inflammation. Regular training changes the baseline. Trials in older adults show that aerobic resistance and multi-component exercise can improve function and, in many settings, lower inflammatory markers. Smoking, persistent psychological stress, Heavy alcohol use and untreated chronic disease can each add another input to the same system. The effect is cumulative. A small sleep problem plus inactivity plus gum disease may matter more together than any one factor appears to matter alone. Now follow the signal into the blood vessels. The inner lining, called the endothelium, controls dilation, clotting balance, and communication with immune cells. Persistent inflammatory signaling can reduce nitric oxide availability and make that lining more reactive, which favors stiffness and poorer control of vessel tone. It can also make it easier for immune cells to enter a developing arterial plaque. Cholesterol still matters, but inflammation helps determine what the vessel wall does with it. This is one reason cardiovascular risk cannot be understood from cholesterol alone. Blood pressure, smoking, glucose, kidney function, activity, and inflammation all change the context. In muscle, chronic inflammatory signals can interfere with the response to insulin and to anabolic signals from protein and resistance exercise. The muscle then receives a weaker instruction to rebuild, while inactivity removes the mechanical reason to keep expensive tissue. Over time, that combination contributes to smaller fibers, lower power, slower chair rises, and less reserve during illness. This is not inevitable at a fixed birthday. Older muscle can still adapt, but it usually needs a clearer signal, adequate protein, progressive loading, and enough recovery. In the brain, inflammatory molecules do not simply pour through every barrier. Yet immune signaling can alter vascular function, supporting cells and neural communication. That does not mean ordinary forgetfulness proves brain inflammation. It means vascular health, sleep, metabolic control, and immune balance are connected to cognitive aging. In bone, inflammation can tilt remodeling toward greater breakdown, especially when combined with inactivity, low protein, vitamin D deficiency, or hormonal changes. In the immune system itself, chronic activation creates a paradox. More background noise does not necessarily mean better defense. An exhausted or poorly coordinated response may react too much to harmless signals and too slowly to a real infection or vaccine. This helps explain why inflammaging is described as both inflammatory and immunologically inefficient. The system is louder, but not always more accurate. Across all these organs, the common result is reduced resilience. The body still functions, but it takes longer to recover from the same disturbance. That is the pattern worth noticing. Not one symptom, but a shrinking ability to return to your previous baseline after stress, illness, poor sleep, or exertion. Can you measure this hidden process? Partly, but not with one perfect aging test. C-reactive protein, or CRP, is one common marker made largely by the liver. High-sensitivity CRP can add context to cardiovascular risk in selected people, but it does not identify the source of inflammation. A cold, dental infection, recent injury, hard workout, autoimmune disease, and many other conditions can temporarily raise inflammatory markers. That is why one isolated result should not become a self-diagnosis. Clinicians interpret the number with symptoms, medical history examination, and sometimes repeat testing. There's also no home symptom checklist that proves inflammaging. Morning stiffness, fatigue, slower recovery, and abdominal fat are non-specific clues, not a verdict. The practical approach is to look for modifiable sources and follow meaningful outcomes. Waist trend, blood pressure, glucose control, strength, walking capacity, sleep, and oral health. Seek medical assessment for unexplained weight loss, persistent fever, severe fatigue, chest pain, breathing difficulty, or a hot, swollen joint. Those are not anti-aging projects. If you have an autoimmune condition, cancer, infection, kidney disease, or prescribed medication, the priority is coordinated care, not an internet inflammation protocol. Now we can build the useful part, a hierarchy that lowers unnecessary signaling without weakening the defenses you actually need. The first lever is frequent movement. Long periods of sitting reduce muscle contraction, blood flow, and glucose disposal, even if you exercise later. Break long sitting with 2 or 3 minutes of walking, calf raises, or repeated chair stands when safe. Small contractions restore circulation and metabolic demand. Then build a weekly aerobic base. Brisk walking, cycling, swimming, or another joint-tolerable activity should raise breathing while still allowing controlled speech. The exact dose depends on health and starting capacity. Consistency matters more than one exhausting session that creates pain and removes the next week of movement. The second lever is strength training because muscle is both reserve tissue and a major site for glucose disposal. Walking alone rarely provides enough progressive load for every muscle group. 2 or more weekly sessions can include chair stands, wall push-ups, rows, step-ups, carries, and calf raises, adjusted to balance and joint tolerance. Progress one variable at a time. A few more repetitions, slightly more resistance, better control, or a larger safe range of motion. Muscle soreness can occur when training changes, but sharp pain, chest pressure, faintness, or unusual breathlessness is a reason to stop and seek guidance. The third lever is meal structure. The anti-inflammatory pattern is not one berry spiced tea or supplement. It is what repeatedly occupies the plate. Build meals around a meaningful protein source and fiber-rich plants. Then add minimally processed sources of fat and carbohydrate that fit your medical needs. Examples include eggs, fish, yogurt, poultry, beans, lentils, tofu, vegetables, fruit, whole grains, nuts, seeds, and olive oil. Variety matters more than worshiping one food. Protein supports tissue repair and muscle retention. Fiber feeds gut microbes that produce metabolites involved in barrier function and immune regulation. This does not make every processed food poisonous. The problem is displacement. When refined low-fiber foods repeatedly replace protein and plants, the whole pattern loses protective structure. If excess visceral fat is present, gradual fat loss can reduce one inflammatory source. But the plan should preserve muscle through protein and resistance training. A shrinking scale number with weaker legs is not a longevity victory. Track waist, strength, and function alongside body weight. The fourth lever is sleep regularity. Keep a dependable wake time, allow enough sleep opportunity, and treat repeated snoring, gasping, or daytime sleepiness as inflammation. The fifth lever is oral and respiratory health. Brush, clean between teeth, attend dental care, avoid smoking, and address persistent cough or breathing problems. The sixth lever is control of known disease. Blood pressure, diabetes, gum disease, arthritis, and chronic infections create less damage when they are properly monitored and treated. Vaccination and appropriate medical care may sound less glamorous than anti-aging supplements, but preventing severe infection protects reserve and reduces major inflammatory shocks. Do not start daily ibuprofen, aspirin, steroids, or other anti-inflammatory drugs to chase a lower inflammation number unless a clinician has given you a specific reason. These drugs can cause bleeding, kidney injury, blood pressure problems, infection risk, and interactions. Lowering one signal is not automatically the same as improving aging. The same caution applies to supplements advertised as senolytics. Interesting laboratory biology is not the same as proven whole-body treatment in humans. A safer 4-week experiment begins with measurement, not medication. Record your usual wake time, daily steps or walking minutes, chair riseability, waist, and sleep quality. During week 1, add brief movement breaks and a 10-minute walk after one meal on most days, if walking is safe for you. During week 2, add 2 simple strength sessions built around controlled chair stands, pushing, pulling, and calf work. During week 3, improve one repeated meal rather than redesigning your entire diet. Add protein, add plants, and remove the item that regularly crowds them out. During week 4, protect a consistent sleep window and deal with one neglected source such as gum bleeding, smoking, medication review, or possible sleep apnea. At the end, repeat the same measurements. The first useful changes may be steadier energy, better walking recovery, easier chair rises, improved sleep, or a smaller waist trend. Do not expect every inflammatory marker or symptom to transform in 4 weeks. The purpose is to build a system you can continue long enough for biology to adapt. The most powerful feature of this plan is that the levers reinforce one another. Strength improves glucose disposal. Movement supports sleep. Sleep supports appetite and training. Better meals support muscle and gut function. Less smoking exposure protects vessels and lungs. Oral treatment removes a persistent local burden. Instead of searching for one master switch, you reduce several inputs feeding the same background alarm. That is how a whole-body process is approached honestly. You may still have arthritis, vascular disease, diabetes, or another condition that needs specific treatment. A shared mechanism never erases the diagnosis underneath it. But treating the diagnosis while ignoring sleep, muscle, visceral fat, smoking, or oral disease leaves preventable signals active. The reverse is also true. Lifestyle cannot replace necessary medication, surgery, dental treatment, or specialist care. The two approaches should support each other. This is the balanced interpretation of inflammaging. It is real enough to matter, broad enough to connect systems, and complex enough to resist miracle solutions. Return to the knee that stays sore, the meal that feels heavier, and the poor night that steals the next day. None proves one hidden disease. Together, however, they can reveal a body recovering less completely from ordinary challenges, which is often more useful than asking whether one organ feels old. The goal is not to silence your immune system. It is to reduce unnecessary alarms while preserving a fast, accurate response to genuine damage. A younger biological pattern is not a permanently quiet body. It is a body that can become loud at the right moment and quiet again when the work is finished. That ability to return is resilience. And resilience is trainable even when chronological age cannot be reversed. Every walk that interrupts sitting, every strength session, every balanced meal, and every protected night gives the resolution side of the system another advantage. The changes are not dramatic in one day. Their power comes from repetition, because chronic signals were also built through repetition. Choose the weakest lever, make it reliable, and then add the next. A modest plan repeated for months beats an extreme plan abandoned in a week. If movement is the weakest lever, begin there. If sleep or oral disease is the obvious burden, solve that obstacle while continuing safe activity. If several systems are changing quickly, bring the pattern to a clinician rather than treating each symptom with a separate supplement. The hidden process becomes less frightening once it is specific. Signals, sources, tissues, measurements, and actions can all be separated and examined. You do not need to fight inflammation everywhere. You need to help your body finish the job it started and stop paying the biological tax after the danger is gone. That is the quiet difference between merely surviving each stress and recovering with enough reserve left for the next one. Protect the return to baseline, and you protect vessels, muscle, metabolism, brain, bone, and immune function at the same time. The silent process ages everything by keeping the alarm slightly active. The practical answer is to make activation brief, resolution complete, and recovery part of daily life.